Arterial supply of the face. The face receives a rich blood supply from two main vessels, the facial artery and the superficial temporal artery. These arteries are supplemented by several small arteries that accompany the sensory nerves of the face. The facial artery further gives off 5 different branches. Number 1, the submental artery. Number 2, the inferior labial artery. Number 3, the superior labial artery. Number 4, the angular artery. Number 5, the lateral nasal artery. The facial artery arises from the external carotid artery. Having arched upward and over the submandibular salivary gland, it curves around the inferior margin of the body of the mandible at the anterior border of the masseter muscle. It is here that the pulse can be easily felt. It runs upward in a tortuous course toward the angle of the mouth and is covered by the platysma and the risorius muscles. It then ascends deep to the zygomaticus muscles and the levator labii superioris muscles and runs along the side of the nose to the medial angle of the eye, where it anastomoses with the terminal branches of the ophthalmic artery. Now let's discuss the branches of the facial artery. The first branch, the submental artery, arises from the facial artery at the lower border of the body of the mandible. It supplies the skin of the chin and the lower lip. The second branch, the inferior labial artery, arises near the angle of the mouth. It runs medially in the lower lip and anastomoses with its fellow on the opposite side. The third branch, the superior labial artery, arises near the angle of the mouth. It runs medially in the upper lip and gives branches to the septum and ala of the nose. The fourth branch, the lateral nasal artery, arises from the facial artery along the side of the nose. It supplies the skin on the side and dorsum of the nose. After giving off the lateral nasal artery branch, the facial artery then becomes the angular artery, which goes along the side of the nose towards the medial angle of the eye. The second major artery of the face, the superficial temporal artery, is the smaller terminal branch of the external carotid artery. It commences in the parotid gland. It ascends in front of the auricle to supply the scalp. The transverse facial artery is a branch of the superficial temporal artery. It arises within the parotid gland. It runs forward across the cheek, just above the parotid duct. Finally, the supraorbital and supratrochlear arteries are branches of the ophthalmic artery, and they supply the skin of the forehead. This brings us to the end of the arterial supply of the face. Thank you.